And we'll give folks maybe 1 to 2 more minutes to join before we get started. Okay, well, I'm going to call it and say, let's go ahead and get started. Well, folks, thank you so much for being here. I'm Shannon Roberts. I'm a senior program manager with the Peer Recovery Center of Excellence. This is our February call in our evaluation series. We'll be talking about process evaluation. Our guest here today is Ben Suker of, I've already forgotten, a group out of Minnesota, and I'm sure Ben will shout it out, and I'll make sure to throw their link in the chat. But just as a reminder, please stay on mute while Ben's presenting. He said that he's totally fine if you have questions throughout. This is meant to be a dialogue, so if you have questions, please shout them out. I'll be in the chat, so happy to answer questions there as well. And I think that's it. In a few, by tomorrow, you'll have the slides, a recording of today's session, and then also a survey link that helps us know how we're doing and how we can make future trainings better. So with that, Ben, I'll give it away to you.
Sounds good. Thanks for teaming me up there, Shannon. I'm going to start sharing my screen, and I hope this works. All right, looking good. Great. Thank you very much. Yeah, like Shannon said, please feel free to just interrupt me at any time. My role is like very inward facing. I don't do a lot of presentations, so the more conversational this can feel, I would say the better. But yeah, just to introduce myself, my name is Ben Suker, and I work as an evaluator for Serve Minnesota, which is the state AmeriCorps commission in Minnesota. And there I provide support to several different AmeriCorps programs, specifically focusing on data collection and reporting. And this afternoon, I'm just quite grateful to have an opportunity to speak with you all about one of these programs called Recovery Corps. This is a program that I think represents a good example of how ongoing process evaluation can serve as a strong backbone for understanding program implementation and program improvement. And my title is technically impact evaluator, so I'm more involved with like measuring program effectiveness, but I'm hoping to still be able to shed some insights gained through ongoing process evaluation efforts that we're doing with Recovery Corps. Insights that kind of go into the how and the why behind the program and associated outcomes. So I'll say that throughout this presentation, I've included a green magnifying glass icon that's just intended to signify those instances where process evaluation insights have directly influenced program changes, highlighting that like dynamic relationship between process evaluation and program improvement. And real quick, for those who might not know what AmeriCorps is, the way that I usually describe it to people who aren't as familiar is that it's like the domestic Peace Corps. So it's a national service program administered through a federal agency whereby people commit to serving for a period of time, anywhere from 1 to 4 years, in a way that addresses some sort of issue area, such as education or disaster relief, public health, environmental conservation, just to name a few. The diagram that I have here just shows the program design and the collaborative framework between the key stakeholders involved in Recovery Corps. So like I said, I'm with Serve Minnesota, part of an innovation and improvement team that's really guided by this central idea that AmeriCorps is uniquely positioned to bridge the research to practice gap. So probably the most straightforward way to say how we think about national service programs is that we believe that when researchers, community members, and programs work together, good things are going to happen. AMPACT on here, they're a key partner who's the implementation wing of the program. They have decades of running AmeriCorps programs. And then we have the community organizations, and these are the locations that partner with the Recovery Corps program and host members for their year or their years of service. And then beyond those immediate collaborations, it's also important that we recognize the contributions of some of the more external stakeholders, including research expertise and community expertise, who provide ongoing additional support, guidance, and insight to ensure that the program is working as effectively as possible. So we're always trying to build in feedback loops so that each party is aware of what the other is doing. That's what these arrows are representing here. They're feeding into the model. And I see this as like process evaluation efforts. So we're continuously seeking to better understand program processes, program procedures, ultimately to gain insights into how things are working, identify strengths, pinpoint areas for improvement, and ultimately enhance the efficiency, effectiveness, and just overall performance. So as I'm going through all of this, I also just wanted to call out the fact that I think it's important to keep in mind that when talking about like program design, it's not necessarily about introducing something completely new. I think everybody in this Zoom room can probably attest to the fact that good peer recovery support has existed long before Recovery Corps has existed. So it's really not about reinventing any wheel as much as it is about finding the right wheel and then identifying what, if anything, we need to modify to support clarity around implementation, scaling, and evidence building for continuous improvement. So a brief history of the program, just to provide some context. In 2016, the federal agency that administers AmeriCorps programming was late, but did finally recognize the severity of the addiction and the opioid crisis and determined that this was an issue area that could be addressed through AmeriCorps service in some sort of way. So each state commission, including here in Minnesota, was tasked with developing and tailoring programs to their unique context and needs. So for example, in Arizona, there's programs that are focused on safe pain medication disposal with the more aging population there. In Iowa, members are providing more prevention education curriculum to students in schools. But here in Minnesota, despite a very well-established treatment ecosystem, we were able to identify a large and significant gap in the resources and funding that are being directed towards recovery strategies outside of those traditional treatment settings. So this realization, in tandem with kind of the AmeriCorps ethos of like service to others and how that's a key pillar in maintaining one's own recovery, led to the creation of Recovery Corps. And during its initial years, Recovery Corps underwent a pretty significant evolution. In the first year, the program primarily partnered with drug courts, but this approach really overlooked a substantial portion of individuals in recovery. So subsequently, the program broadened site partnerships with members focusing on providing employment services at first, which in retrospect was pretty foolish because it became quite evident early on that the needs of participants extended far beyond employment. So this realization prompted a refinement in the program model, which has remained relatively consistent since then. So there are two kind of AmeriCorps member positions within Recovery Corps. We have Recovery Corps navigators, who are people in recovery themselves, and they provide peer recovery coaching services for people all along the addiction and recovery care continuum. They're resource brokers. They provide linkages to the recovery community, and then just other needed supports to help build that recovery capital. And then we have the Recovery Corps project coordinators. So these people are not necessarily in recovery themselves. I would say that about 60% are, but they still possess like a deep interest in like addiction as an issue at a more like systems level. So kind of that intersection with like larger public health entities, and they engage in more capacity building work behind the scenes, kind of complementing that direct service efforts that navigators are providing. In this ongoing process of, assessment and adaptation, I think, underscores the commitment to meeting these evolving needs of individuals affected by substance use. And it's just one of the many instances that the role of process evaluation has had in shaping programmatic changes. And then in the years since then, this more refined program model has been replicated in both Illinois and Virginia. So the current scope of the program, the heart of the program, I would say, is this like expansive network of site partners, which spans various sectors within the addiction and the recovery care continuum. We have 197 total members serving across 98 site partners in the 3 states, which I think embodies a holistic approach to addressing addiction. These partnerships encompass a wide range of organizations, each playing a unique role in addressing substance use in some way. Those are listed here: recovery high schools, collegiate recovery communities, harm reduction organizations, recovery community organizations, state and local agencies, larger social service agencies. So really a wide swath of program site partners, all of which are advancing recovery initiatives in some sort of way. And I would say that the program's expansion into new states and new site environments has promoted some process evaluation efforts to just understand and then navigate the challenges posed by diverse implementation contexts. I see this like holistic approach to site partnership as an overall good thing, but it also presents challenges in ensuring standardization across implementation in different settings. And one other thing that I want to make mention of is that there's been recently strategic program efforts to partner with more harm reduction organizations to meet the need that is being presented by the ever increasing lethality in the drug supply. So I went over this in just a couple slides ago, but wanted to include a bit more context here. It's about Recovery Corps Navigator activities. And I think the thing that I want to call out specifically is the members providing this like ongoing peer support to participants. So we know that there's still a good amount of people involved with the program who receive kind of those one-off acute need services that members are attending to. But the program model is kind of designed to provide ongoing peer support and not that like one-off peer support. So you can see how progress has been made in the graph below there, looking at the percentage of people who receive more than one instance of service provision from navigators. So 4 years ago, it was just under 40% of participants meeting that criteria. And that has subsequently improved year to year and is at just above 75% this year. I think, all the activities that members are engaging in are designed to build recovery capital. So those internal and external resources that somebody's able to draw upon to either initiate or sustain their recovery. This is measured through the brief assessment of recovery capital scale, the BARC-10, an empirically validated scale associated with positive recovery outcomes. Other outcome measurements that the program uses that these activities are connected to are quality of life, self-esteem, self-efficacy, and a reduction in the likelihood of recurrence of use. And then speaking real quick to the Recovery Corps project coordinators. So these are members that are playing a pivotal role in either leading or supporting projects that are tailored to the unique needs of site partners. These projects are strategically categorized into capacity building domains, which I'll get to in a little bit down the line in this presentation. But the overarching aim is for these members to accomplish a series of goals associated with each project, and that by successfully completing a series of projects and goals, partner organizations are able to enhance their capacity to better serve their communities and deliver more effective and expand services to those that are in need. Okay, so I'm just going to kind of go through some of the data collection sources and then again identify some of those key pieces of information that have informed ongoing process evaluation work. So this slide here presents a breakdown of participant demographics across both Minnesota and Illinois for this program year as of the middle of January. I think this does offer some valuable insights into just the population being served by Recovery Corps navigators. The shaded areas in the table are intended to signify the magnitude of differences between the states, hopefully to facilitate kind of a quick identification of where the significant variations are. So kind of the process evaluation insight here concerns a change that we made this year to determine the recovery pathway or the pathways that a participant utilizes. This change was supposed to promote more tailored services by members by recognizing that each individual's recovery journey is distinct. And the hope is that the renewed focus seeks to, understand these diverse participant experiences and deliver interventions accordingly. So the data, it shows us that 12-step is a relatively balanced recovery pathways and represents the most utilization, which might represent the widespread acceptance and reliance on this traditional recovery model. Counseling and therapy is not far behind and slightly less balanced, but not as dramatic as the differences in the other three recovery pathways listed here. So just interestingly, faith-based or spiritual practices, we see that being utilized 27% more in Minnesota relative to Illinois. So this point the need for the program to be cognizant and sensitive to the cultural and historical backgrounds of participants. Another interesting difference is the use of medication-assisted therapy, or MAT, where in Illinois, over 30% of participants are utilizing this as a recovery pathway. And this might, reflect the differing levels of opioid use in that state relative to Minnesota, knowing that MAT, like buprenorphine or Suboxone, are primarily used to treat OUD. Again, what this could underscore, the importance of the program to be adaptable and responsive to the more like medical needs of participants. Lastly, the self-managed recovery pathway being utilized significantly more in Illinois compared to Minnesota might reflect a greater emphasis on self-directed empowerment and recovery, which could be due to the lack of existing support structures with where that program is currently operating in Illinois. So going back to that map, we know that Illinois is operating in a lot more rural areas than Minnesota. In Minnesota, most of the programming is concentrated in larger metro areas like Minneapolis, St. Paul, and in Duluth. In Illinois, it's far more spread out with, despite having significantly fewer members, there's a larger geographic scope of service, and members are serving in more counties than they are in both Minnesota and Virginia. So this slide here contains two figures that show comparative analysis of the ethnicity represented in Recovery Corps participants with statewide drug overdose data, both fatal and non-fatal in Minnesota and just fatal in Illinois. And one note that I want to make here is just around these inherent data challenges that we have in comparing program demographics to state-specific data. There's a lack of national standards, as some of you may know, in data collection and reporting on substance and opioid use disorder, which just leads to variations in how data is gathered and how it's categorized, not just from state to state, but often between different agencies and organizations within the same state. And also, we know that each state has different health policies and data reporting protocols that can significantly influence the availability of the data that we have at our disposal to compare the program against. But we do our best just to see, like, is the program serving those who are most impacted in the states that the program is operating in. So in Minnesota, right, we see that program participants largely mirror state data, which suggests that outreach and implementation are pretty well tuned to the demographic realities of the state. And again, kind of from this process evaluation lens, in Illinois, we see some pretty sizable differences. I think that the data is telling us that there is a possible need to adapt outreach and partnership strategies to ensure that the program is more effectively reaching and serving the populations most affected by substance and opioid use disorder in that state. So to that end, I know that recently a new staff member was hired in Illinois who has much deeper connections to the Chicago metro area, which I think signals a good proactive step being taken towards aligning the program efforts with state needs, knowing that a significant population is concentrated in the Chicago metro area. So kind of moving away from the more rural site partners and partnering with organizations serving in a more metro dense area. I think, yeah, just understanding that the demographic landscape is always going to be important to make sure that the program is aligning to statewide trends and inform program strategy as it comes to aligning programs with different site partners. So moving away from demographics and into implementation. So this slide here outlines the implementation data collected during each instance of service provision that a navigator provides. So this includes some important information like minutes of service, the modality of service, the date of next scheduled meeting, individual or group sessions, the focus of the session, and then any sort of pertinent notes that a member might make to inform their service delivery. And I just want to say here that, there's a lot of numbers presented here. So just important to step back and realize that each session represents a meaningful interaction where a navigator provides support, provides guidance, resources to individuals in recovery. So just want to acknowledge the significance of these interactions and not just have it all lost in numbers here. So far this year, navigators have conducted nearly 7,000 of these sessions, each of which does play an important role in supporting those in their recovery journey. As it pertains to the process evaluation insight here, I think it's important to note how the program has responded to the challenges that were brought about by COVID. So, the pandemic ushered in isolation and loneliness and economic hardship, all of which are known triggers for recurrence. So many traditional support systems were disrupted. Organizations faced challenges in rapidly transitioning to providing more telehealth services. And then as a program, we added to the data collection approach an item pertaining to modality, knowing that many members are going to be transitioning from providing more services over the phone or video conferencing, which brings about important questions that we want to continue to explore, like, are these remote services proving to be just as effective in increasing recovery capital as in-person interactions? And I think this is an aspect that we're continuing to explore as part of our ongoing evaluation efforts, recognizing the need to continuously adapt and innovate in response to changing circumstances. Okay, and then this slide presents some implementation data from the 21-22 program year, and it focuses on the lag between when members began their service and the creation of their first participant record. So on average, we saw a significant 5-month lag between when members began serving and then when they created, on average, that first participant record. It's notable, I think, that 69% of participants initiated their service after January 1st. Just almost 90% of participants began after November 1st. So these findings when we first started really diving into the data and kind of wanting to understand, through a process evaluation lens, like how is this program like working? What is implementation looking like? It really led us to dive into these like underlying reasons behind these lags and these delays. So efforts to address these could could take the form of making sure that partner sites have the mechanisms in place needed to connect members with participants, or maybe the program should revamp the training approach. So the really like comprehensive training sequences aren't all done, before members are like ready to serve participants, but instead being offered in a more like asynchronous sort of way. So a few changes were made between 21, 22, and then last program year 22, 23. So we can see that now inside that 5 month leg, we're seeing an average of just over a 3 month leg. So it presents similar implementation data with the leg being reduced. We also see that the amount of participants beginning after November 1st is lower pretty significantly, and the same with the participants beginning service after January 1st. So I think these findings indicate progress towards addressing the delays observed in the previous period. However, there's still ample room for further improvements. So the implementation team continues to undertake some efforts to streamline these processes to enhance the timeliness of participant engagement and ensure that there's more effective coordination between members and sites. And hopefully, the next time we look at this data for this current program year that we're in, we'll continue to see more progress being made. This is a fairly busy scatter plot, but it does kind of pertain again to this process evaluation piece. So this is a visual representation of the engagement levels of each active recovery core navigator in Minnesota and Illinois, again, as of the middle of January. The data is segmented into 4 distinct quadrants, each offering different insights into the nature of how members are engaging with participants. So the quadrants are broken up by looking at the average number of participants per active member, which is 14 on the x-axis there, and the average number of services being provided per member, which on average, when we looked at this last month, was 50. So, we see kind of distinct patterns playing out. We have this like extensive engagement quadrant, which suggests some wide-reaching and deep impact, which implies that members are kind of adhering to the program model as intended. They're actively engaging with numerous participants and they're delivering a high volume of services. We have another quadrant, this like focused intensity quadrants, where we observed a more concentrated effort on fewer participants, coupled with a high level of service provision. So members are still providing services just to less people. So the intensity remains high, but the amount of people being served is lower than average. We have this limited interaction quadrant in the bottom left, which suggests both a lower level of activity in terms of both participants and services provided. So members falling into this category, maybe they're relatively new to the program, or they're less active in their engagement efforts, or the sites that they're with don't really have things in place to kind of facilitate that connection to make sure that members have people to work with and provide peer recovery support too. So I think from a process evaluation standpoint, we really want to look at the sites and the members in this quadrant to understand what these factors are that may be contributing to limited interaction, and then use that information to inform strategies to increase member involvement. In the last quadrant here is broad outreach. So we see in this quadrant a wide reach in terms of participants being served, but a lower depth of service provision. So members may be engaging with a large number of participants, but there may be more opportunities to enhance the depth or the quality of interactions to maximize impact. So as a program, the questions that we're asking right now is like, is it okay that some sites and members are, doing more focused intensity or more broad outreach? I think the answer is yes. I think that's fine. We know that there's going to be site variance in how the program is playing out. And I think that both members and sites kind of in these two different quadrants, they're doing great work, and we just might have to adjust expectations accordingly depending on where members are served. So again, through that process evaluation lens, just continuing to analyze member engagement has allowed us to understand more of the dynamics that drive program effectiveness and also identify areas for improvement. So that's all I'll say about that scatter plot. And then thinking back to that Recovery Corps navigators like activities slide, one thing you might recall is that members engage in goal setting and action planning with participants. And this has like been baked into the program like logic model. When we explain the program, we always say that these are like activities that members do. And I think, we know that's like broadly been true, but we never really had like the documentation processes to see how this actually plays out. So something that we did this year in the data management system specifically was to update it to better capture this like structured goal setting process that members are using. So now we have like a multi-step process that members are using to set some goals, some of which are like predefined, which are listed here in this table, such as securing stable housing, finding employment or returning to work, things like that. And then members are also reflecting on action planning. They're tracking goal progress. They're tracking achievements and like associated resource attainment. So this like more systematic approach to goal setting and tracking emphasizes a more organized approach, I think, to capturing something that we only had anecdotal evidence of. The table on this slide here just shows like a variety of goals that the program participants are working towards, and also I think illustrates again that diverse needs of those being served, with goals ranging from developing coping strategies to finding employment, all of which I think just reflects the multifaceted nature of recovery. This year, over 1,600 goals have been added. So about 3 goals per participant. 234 participants have accomplished at least 1 goal. Interesting note here is that like a disproportionate amount of those achieving goals are occurring in Illinois, which is pretty fascinating and something that we could explore as a program, like what's going on in Illinois where members are providing services that are leading to more goal accomplishment than in Minnesota. So having just this new mechanism in place to track goals and associated barriers and action steps needed to complete is a big step into understanding how members are carrying out their service. And then this slide presents the outcome measures collected by the program, encompassing various dimensions of participant progress and participant well-being. These measures are important in just assessing the effectiveness of the interventions being provided and also guiding programmatic decision making. So one key aspect of this ongoing process evaluation involves a new protocol whereby kind of the implementation and the outcome data that used to be like combined into one form, and we have since delineated that and like decoupled them to simplify the data collection process, to reduce kind of the data fatigue that members and participants were feeling, and just kind of reduce burdens across the board. And this decision was informed by some time series analysis work that we did on the previous year's data, which showed that collecting outcome data every 2 weeks instead of every session would retain a significant, about 85% of the outcome data. So this kind of optimized approach has led to greater efficiency without compromising the richness of data being collected. And then we just have a couple of slides around participant outcomes. Nothing here really about process evaluation per se, but I thought it was just good to call out. So we're seeing participants continuously experiencing growth on recovery capital. So we have a graph that just shows since 1920 and a comparison study that's cited here. Kind of the first instance of recovery capital score, just like an average of that across the entire program, and then the last instance of recovery capital score. The score is out of 60. So we see, for last year, on average, participants were seeing 46.5 score during their first instance of service, and then on average, the last instance of service was showing a 49.8 score. I also have a dotted line included here that shows a recovery capital score of 47. This is a particularly significant number, as research has shown that individuals who have a score of 47 or higher are significantly more likely to reach or sustain a year or longer of recovery. And something that has been observed over the last 3 years, at least in Recovery Corps, is that first instance of service score is below that 47 number, and then the average last instance of service score is above that. So I think that's just a kind of a cool data point to articulate the value that the program is having. And then the line graph on this slide shows that as the number of sessions that a participant has with the navigator increases, so does that corresponding average of recovery capital score. Again, just some evidence that speaks to the underlying theory of program change, which is, the more services that are offered, the better the outcomes will be. Here are just a few more outcomes. Recovery capital, that's like the main performance measure that we are required to report on for AmeriCorps purposes. But we also see subsequent growth in quality of life scores, in the scores around substance-free last 30 days measure, and then also changes in the average self-esteem and self-efficacy scores from baseline to final session. And then there's like one interesting piece that I like to point out, I guess, is that the magnitude of difference between self-esteem and self-efficacy since we measured these, the last 4 years, we always see that the magnitude of growth is greater in self-esteem than it is in self-efficacy. Self-efficacy typically has the lowest level of growth across all of the outcome measures. So that's just an interesting fact that I think, might warrant some more inquiry down the line. Okay, so moving away from navigator data, the project coordinator data isn't as robust, so this will be quite a bit shorter than what I was just talking about. But here is where I just want to mention that measuring the concept of capacity building is a lot more nebulous and has traditionally been harder to quantify than these outcome measures that we're using for navigators. So for most of the program's existence, our understanding of implementation and of impact of project coordinators specifically has been limited and has been reliant almost entirely on anecdotal evidence. But in the last program year, we implemented a few more robust measures to capture capacity building data. So this began with a capacity assessment that's administered before and after the program year, where sites are rating their current capacity levels and their current capacity needs across various domains. And these pre-program year results are presented on this slide here. This assessment is from the most recent program year, 23-24. And across the board, we're observing that each domain has a lower average current capacity score relative to the current need score, which indicates that there are existing gaps for members to address and opportunities to enhance site capacity. One particular domain that stands out here, I think, is community engagement and communications, where it has the highest need indicated, but also the highest current capacity level indicated. So don't really know what this means. I think it might signify that sites have deemed this element of like organizational functioning to be like especially important in achieving goals, and that there's also like a relatively strong foundation already in place. So they might be well positioned to collaborate the program and support members to strengthen their capacities within these domains. This slide just shows how members allocated their time during the 22-23 program year and provides some insights into whether service activities were aligning with those previously identified capacity needs. I won't get into it too much, just to kind of call it a few differences. Like in Illinois, something that stands out is that 35% of member time was dedicated to new program development, which maybe signals a direction to pioneer some new recovery initiatives in that state. And in both Minnesota and Virginia, we're seeing kind of a more balanced distribution across these like top service domains, with Minnesota leaning slightly towards community engagement and communications, and Virginia leaning more towards new program development. So then sites are providing these capacity levels and need scores across the same domains, and they're responding to a few like additional questions about capacity built and some of that associated member impact. So this slide's a little busy, but I'll just say that what we saw last year was a noticeable increase in post-service capacity levels across almost all of the domains, which reaffirms the role that project coordinators had in bolstering site capacity. This is most evident in the data collection and management domain. We also see it, in the community engagement and communications domain. And we did kind of just observe a relationship between that like allocation of time and associated capacity gains. So that I think provides some underlying evidence again to the theory of change that members spending their time in certain capacity building activities has an associated and related capacity kind of gain and impact. And then, additionally, 83% of sites emphasize that project coordinators significantly expanded their reach to new communities, be it geographically or demographically. And then in terms of the type of capacity increases experienced by site, efficiency stood out predominantly, with 83% of sites reporting that member service, augmented operational efficiency due to the services provided by Recovery Corps project coordinators. So, this slide, I just wanted to call out. So again, from this process evaluation lens, a significant evolution has taken place in like how project coordinators are documenting their work. So each site and each member is kind of working off this service plan, which outlines, it's like a blueprint essentially for how they're supposed to be spending their time and like what projects they're supposed to be working on. In the previous program year, 22-23, the development of this service plan was on site partners. They took the lead in developing these, and then we uploaded these plans as like a static Word document. So the feedback that we received there is that this approach really like limited the flexibility and adaptability of the position, and it made it hard to account for the ever-changing nature that members are experiencing throughout their service. We know that site needs are going to evolve, and they're going to evolve rapidly. So we wanted to transition into like a more dynamic and a more collaborative model. So now things are set up for sites and for members to collaborate closely and in tandem to design these more individualized service plans instead of site-based service plans. And this just enables more real-time modifications to be made to align with these evolving needs. And it allows for plans to be more tailored to a member's specific skills and interests and the unique requirements at their sites as well. So the hope here is that we'll be able to gain deeper insights into individual member activities, and also have like a mechanism in place to facilitate more timely support in coaching interventions through members. So the other thing here is that, so we have the capacity domains, and then we have the percentage of projects categorized by those. And not surprisingly, based on what we knew from last year and how members were allocating their time, the biggest kind of domain that members are working in is community engagement and communication. And these numbers aren't going to add up to 100% because members have the ability to categorize their projects using one or more of these domains, which I think is a positive improvement because last year there's some confusion how to categorize work. If, for example, somebody was working on like a harm reduction program that required, administering surveys. So now instead of having to decide, is this data collection management work? Is it harm reduction services work? They can just categorize the project as both of those. Okay, just wrapping up here. Data management and monitoring. These are like critical components to the program's infrastructure and ensures that we have things in place to effectively capture and analyze and utilize program data to drive decision making and program improvement efforts. So recovery core data is stored and managed across three main applications. NAC, it's a primary web-based, it's a HIPAA compliant data storage system. This is used exclusively by navigators in both Minnesota and Illinois, as well as by all project coordinators. So it's customizable to fit the unique needs of the program. We have a Power BI page. So this is linked to our NAC database, and this provides, just more enhanced like data visualizations that is user-friendly for program staff and program leadership to explore and interpret data and just kind of satisfy any inquiry of the program they may have. There's like filtering options available and just allows for like quick understanding of how progress is being made towards implementation and outcome goals. And then in Virginia, we have members using the Advanced Recovery Management System or RECCAP system or ARM system. This is a more robust data platform designed specifically to track peer support services and kind of identify an individual's recovery strengths and barriers and unmet needs. It also tracks the longer term outcomes of participants as well. These are just some screenshots from the Power BI page. The one thing I wanted to call out here was just in the project coordinator page where we have the different kind of goal units seen here. So another change that we made was having more clear and measurable goal setting as like a fundamental aspect of the program. So now members are kind of defining what the goals of their service is, and then we're able to kind of aggregate that information and track it. So we're able to say things like year to date, members have reached 2,416 community members, or we could be used for coaching, looking at the anticipated goal value for surveys or assessment distributors is 731. We've only seen 98 being distributed. Maybe program coaches can see which members might need like additional support in like survey creation or like best practices for administration, things like that. Just quickly, knowing that we're running up against time, just some other evaluation results here. First thing to call is like overall sites are having a positive experience participating in the program. And I'll just, in the interest of time, point to the pie graph that shows that 88% of members responding that they're either very likely or likely to pursue a career in recovery and or substance use services. So from a process evaluation standpoint, seeing this information, we have a lot of evidence that like members are interested in using this service year experience kind of as a springboard for a career doing this work. And we know anecdotally that many members who serve go on to be hired by their site. So last year, there was a pilot kind of career pathway initiative that's been built out to strengthen that service to employment pipeline. And now members are provided with the information that they need to apply for and to take and to ultimately pass the exam needed to obtain their certified peer recovery specialist credential to do this work professionally. So that's an exciting development. I think, ultimately the data about the recovery care workforce is pretty limited because each state has their own like healthcare system developed and their own behavioral health peer recovery training and certification systems in place. So little is known about like the scale of the workforce or the scope of their assignments or the challenges that they face in launching and maintaining their careers. But the hope is that by like formalizing this career pathway work, we'd be in a position to bring more data and more understanding to this like discussion on how to better build the recovery workforce. Then the last bit here. So all the data has really been focused on participants served by the program and sites served by the program, but it kind of ignores the impact that serving has had on the members themselves. So to that end, we're hoping, or we are participating in a collaborative research project being led by Dr. David Best that leads Trinity University that will hopefully provide some insights into the impact that service has on the recovery core members themselves. So it's a study with like global partners, and there's a focus on connecting kind of outcomes at the participant and the member levels, and ultimately just poised to add some more depth and understanding of the program's effectiveness, specifically on members themselves. These are just some final thoughts, but I know that we're on time and want to make sure there's any opportunity for comments or questions that people may have. So I'm just gonna leave it here and just thank everybody in attendance for your attention, and happy to answer any questions that you may have.
Ben, we do have a question in the chat. Ashley asked, if you are just getting started in the data collection process and process evaluation of your program, how would you recommend you begin collecting this info? Would you suggest starting with the software and the BARC 10 survey? And Ashley, feel free to come off mute if I misread or misrepresented.
Yeah, that's a great, great question. Just Yeah, I mean the BARC 10 is a really useful way just to get like a quick pulse on how somebody is doing in like the recovery journey. I think it's been like a really useful tool to articulate the value that the program is having. But also I think I mean, if you're just getting started, it might be useful to gather input from, the people either delivering services or receiving services, just to understand kind of what the needs are and like what they're doing, and then maybe design the data collection approach around that. So I'm not sure how helpful that question is, or that answer is, but I'm happy to give it some more thought and follow up directly, Ashley, for some like more context about how we thought about it with recovery core specifically.
Ashley, I'll also add the first session we did on this program evaluation series. I did sort of an evaluation 101 course, and I can send you the recording, but I'll also link in the chat here. One of the CDC has an entire like toolkit resource hub on program evaluation. I recommend checking those tools out. They've got workbooks that you and whoever's in, just like Ben was saying, like talking to the people providing services to get at, what's the data I want to collect? What are the questions I want answered? Anyway, those tools, super helpful. They'll walk you step by step. And the other thing you can do, this training series is part of the Peer Recovery Center of Excellence, and we offer free training and technical assistance. So if you have specific questions, I'll throw that link in the chat real quick too. You can request specific assistance or specific training on that for you or your organization. It's all free of charge. And so if you're wanting to build out an evaluation plan for your organization and your services, we can help you do that.
Okay, thank you so much. I appreciate that. All that would be helpful.
Yeah. I'll grab that link. Anybody else have any questions? All right, well, if nothing else, Ben, thank you so much for your presentation today. Really appreciate you sharing. Everyone, thank you for being here today and listening in. I think I already threw in the chat that our next session will be Tuesday, March 26th. You'll get an email from me by the end of the week with the slides, the recording, all the links that we shared in the chat, and an invitation and reminder about next month's session. And a link to a survey. That's part of our process evaluation. So let us know how we're doing and what other topics you'd like to see from us in the future. With that, I'll sign us out. Thanks, everyone.
Thank you.